Well, here we are with Dr. Martinez, a dentist in Chicago, actually all over Chicago, Joliet, Aurora. Dr. Martinez, hi.
Hi, how are you?
Good. Dr. Martinez, tell us a little bit. You have 3 practices. Tell us a little bit like where they are located, and also tell us, what is the philosophy of your practices, and what type of work are you doing? Because it's not just that a dentist is a dentist is a dentist. Some dentists do certain works, they have a certain philosophy, other ones have a slightly different one. Let people know what you're all about and what your philosophy is in doing dentistry, maybe even why you became a dentist and why you have 3 practices, so successful and so young.
My philosophy is a simple one. It's just to provide the very best dental treatment that I can for everyone that comes in contact with me. I basically try to do what is best for the patient at all times. And it's a simple philosophy, and I think, obviously we don't want to have everyone have the same philosophy, but I think for the most part, I think everybody goes in with the right ideals and the right ideas of treating patients and being warm and caring and patient, because, patients are very scared to begin with to go to the dentist, and I think sometimes it's difficult for them to warm up to someone or to trust someone. So I think our philosophy is simple. It's just doing the very best that we can for our patients. I have 3 practices, as you mentioned. I have them in Joliet, Illinois, Aurora, Illinois, and in the city of Chicago. They are primarily, the Chicago office is located in the Hispanic community. The Aurora and Joliet office is very centrally located right off the highways. And, they're just practices that keep me very, very busy. I'm there. I pretty much work every day, the exception of Thursdays, but I'm always there. I'm always available for my patients.
And you do speak fluent and perfect Spanish, right?
Yes, I do.
Yeah.
Yes,
so wonderful.
Yes, I actually do, and I find that with the patients that we have that are Spanish speaking, it provides a very comfortable environment, because even though sometimes there are providers that have receptionists that speak Spanish or an assistant that speaks Spanish, there's nothing like the communication that you can have with the patient that speaks Spanish. So.
Right, I'm very, very sure of that. Now, when you say, Dr. Martinez, that you want to do the very best work you can do for a patient, well, let me ask you, does that mean you only do high-end dental work because that's what's called the best service, or does that more like mean you do for the patient what he needs to have good, as I might call it, or as many people call it, functional dental health? Not everybody wants a Tom Cruise smile. Maybe we all want it, but we're not necessarily out there able or willing to spend tens of thousands of dollars to get it. At the same token,
exactly.
we all want to have a decent, good look, and most importantly, have a healthy mouth inside, so it doesn't rotten away, something like that.
Exactly. You're absolutely right. No, when I mean provide the very best for the patient, is provide the very best that I can with the knowledge that I have. I will go the extra mile to provide good quality dental work for everyone. You're absolutely right. There are people that can afford and want that Tom Cruise smile, but that there's the majority, I would say, are people that just need to become healthy with their mouth. There are some people that have never been to the dentist. There are some people that have never had an encounter with a dentist. And that's where I believe probably that's the most rewarding and the most, I guess for lack of a better word, most rewarding for a dentist is to actually change some habits and teach patients that it can be done, that they don't necessarily have to all have the movie star smile. That's just not attainable. That's not the right goal to have, I guess.
Right.
So it's just basically to be healthy, to have healthy teeth. A lot of people have the misconception that as we get older that we are supposed to, it's normal to lose our teeth, and that's not at all the reality. The reality should be that we should die with our teeth in our mouth, and it's changing ideas and perceptions of patients that, and educating them into that knowledge of it's not because you're old that you have to lose your teeth. Or, a lot of people also say that, those baby teeth are going to fall out. It is so important for babies to have their teeth, 6-year-olds, 7-year-olds to have their teeth. It's for function and for aesthetics. I mean, just think of how a child feels, of not having their teeth, and their classmates having all of their teeth. Children have the same, wants and needs as adults. They want to look good. They want to look
right,
and they don't want to be different. So it's very important that we educate the patients.
Mm-hmm. No, I definitely get that. I mean, I have heard that there's a very, very heavy correlation, maybe not totally scientifically proven, whatever that means. I'm not so sure what scientifically proven always means, but apparently there's a very heavy correlation that elder people who also have all their teeth in it, which basically means they, whichever way it happened, took care of them. They don't have major gum disease because otherwise they wouldn't have their teeth. But apparently that those people simply are healthier and longer living, period. Can you second that, or is there nothing to it?
I believe that a lot has to do with the dietary habits of our elderly and the dietary habits that we now have. In the past there was a lot of grains, a lot of natural foods. Now it's all sugary, refined, that causes a lot of damage. It's just basically the way we are pretty much taking care of everything else, our health. And again, in the past, I find that people used, because they didn't have it, they used to just eat better. And that has a lot to do with the health of their mouth and why they're able to keep their teeth.
But have you noticed the correlation that people who do keep their teeth live overall healthier and longer?
Oh, yes. Oh, definitely. Definitely. My dad is a perfect example of that. Over 84 years old, all his teeth, and, they're worn because of using the teeth for 84 years. But he has all his teeth. It is amazing to see that for me, where I actually also see a lot of patients that are in their 30s that are missing 2-3 teeth and on their way to missing more teeth. So I definitely see that correlation.
Wonderful. Well, by the way, talking about Tom Cruise's smile, has anybody ever told you that you look like Brad Pitt's wife, Angela?
Yes, I have been told that, and thank you. That's a very nice compliment.
Definitely a very pleasant, nice look. All right, Dr. Martinez, we'll speak to you more. Thanks for this wonderful information.
Thank you very much. I appreciate it.